I would say that the Senate version may be less awful than the House version, but it's awful. I start from that premise. We don't know how many people will be uninsured by the Senate version because the Congressional Budget Office, the CBO, hasn't scored it yet, but it will be millions of people who are likely to lose coverage, both with ceasing Medicaid expansion. So there are millions of people in that population, the lowest income, childless adults who got coverage under the plan in 31 states. But also because the subsidies are lower and because they don't take into account age with as much care, and insurance companies can charge somebody over 55 times what they can charge a young American, and those folks are likely to have pre-existing conditions, it will get more expensive. There is, we know that the bill will give flexibility, whatever that means, to states, and I was an insurance commissioner at one point, so I kind of know this drill, but to states to roll back essential health benefits. So we may have plans that are offered without mental health coverage again, without maternity coverage again. And what that really means is that people who need that care will be paying for it out of pocket or not getting it at all. It doesn't mean that those needs go away. It's just that the federal government won't pay for them. And I think as terrifying as all the pieces are to the Affordable Care Act and the individuals, those 20 million people who will higher costs, many of them will lose their coverage, won't have the benefits they need for their health care, is really, in both the House and the Senate bill, an assault for the first time in 52 years in the underlying Medicaid program. And I don't think this has really gotten enough attention. So Medicaid is now the largest insurance program in this country. About 72 million people are on Medicaid. And those people look like this: 10 million disabled children and adults. Medicaid is the largest payer for nursing home care, and most of those folks are poor elderly, frail elderly who are in nursing homes. Medicaid pays for half of the births in this country. So 50% of the children born, their parents actually are on Medicaid coverage, and that's who pays the hospital bills and pays for coverage, and a number of pregnant women, and 40% of our children are on Medicaid. You can't cut that program by 25%, as is proposed in both the House and Senate version, without cutting benefits to some of those folks. The dollars just don't go around, and no state in the country has enough money to make up that difference. So we're really looking at both people, some of the 20 million new population and some of the expanded Medicaid, but also serious cuts over the next 10 years in benefits to that underlying Medicaid program. I think the Senate pushes the pain a little further down the road.
Right.
But the pain actually is worse in the Senate plan. They cut more out of the underlying Medicaid program than even the House suggested.
Well, let's stop and talk about
Other than that, it's great.